I'd like to start talking about the newborns. This is a model of the internal membranes of the skull that are part of the craniosacral system. They divide the brain into quadrants. This is the hole in the base of the skull where the brainstem comes out of the skull and is housed in the first vertebra, the first bone of the neck. So if that first bone isn't where it's supposed to be, we got a kink in our hose, right? You wonder why there's problems. And if you've ever been part of a birth, most of us have been part of a birth, whether we remember it or not, people that assist at births, moms know, births are hard work. During birth, we don't have a skull, right? We have soft cartilaginous discs, if you will, inside sacs, okay? These structures help maintain the shape of the head during birth. Therefore, if there's any lesioning in these structures from birth, any tearing, any bleeding in these structures from birth, then the body throws in scar tissue. These structures stay twisted, okay, so that would be reflected in asymmetrical features in the face or a misshapen head. So a lot of what we're doing when we're working with the head, we're simply releasing these structures. So if a baby comes through, they've got some coning. If that coning doesn't change within usually about a week, it's usually not going to without some kind of assistance. And that can be mom and dad loving on baby's head. You know, that doesn't have to be a professional like myself. However, if you're talking about the central nervous system, you're talking about the brain and spinal cord, the central nervous system, these structures are the boundary to it. And so if they're strangling the central nervous system can't function. If we've all sat on our feet before and tried to stand up and walk and our feet are asleep, or you sit in a hard chair long enough and your butt goes to sleep. Now, if you put mechanical pressure on a nerve for 5 minutes, that nerve is disabled. Okay, it cannot do its job. Okay, so you have any of these structures, and the first cervical is one of my favorites, one of my soapboxes, is the first cervical not being where it's supposed to be, literally is strangling the brainstem. Okay. So when we talk about conditions, medical disclaimer thrown in there again, I'm not practicing medicine. We sometimes use language so that we're not medical language so that we can be succinct and not have to try and speak too much. People with the autistic diagnosis we said earlier, John Upledger at Michigan State University found that these bumps behind our ears are called the mastoids. Right. I don't recall the exact percentage. I think it was 20%. No, don't remember. There's a percentage of individuals with an autistic diagnosis that he found that these structures were shortened between the mastoids, and those released and their symptomology got better. 50% of the kids that came in as hyperkinetic,
or what's called ADHD, right?
Right. We call it ADHD now. It was called hyperkinetic then. 50% of them, all they needed was the movement between that first cervical and the base of their skull corrected, so that it was moving correctly, and they no longer had that diagnosis. So we can step back a little bit and say, okay, we can throw a blanket on this and say anyone that has a central nervous system can benefit from this work. Okay.
Which is everyone.
Which is everyone.
Right.
And we step back a step further and say, okay, I know I have a head injury, and how many other people do we know that have head injuries? You watch your kids grow up, and we bang ourselves around a lot. Right. So it was 1986 when I started working with my first severely brain-injured individual, and it's just kind of been the snowball ever since. The work is very highly effective in addressing whatever there is going on with the central nervous system, whether it's a brain injury, whether it's a motor vehicle accident, whiplash, facial injuries.
What about trauma? What if a child has experienced trauma or abuse, physical abuse?
Yeah, that's part of why I think my path ended up going more towards the HeartMath Institute, and not the HeartMath Institute, but that whole segment that we talked about, where you're coming from a place of love and compassion watching that happen, observing that happen in myself while I'm working. So we're in training. The recipient was working with a whole series of individuals who were highly traumatized with diagnosis like PTSD and dissociative disorders, where, well, I step back and talk about a baby. I worked with a baby in 2001. It was 2001. Worked with the mother as she was going into labor. Worked with baby when she was 12 hours old. Saw her 3 months later as a follow-up, and she didn't need any work. She was just cruising, no symptoms, happy baby. 2 weeks later, Mom called me. Baby was crying all the time, projectile vomiting. I mean, what we call colic. What we diagnose as colic is this child that can't be quieted. And I'm working with baby, and her first cervical was not where it needed to be. Half of her neck probably wasn't where it needed to be. And I'm working with baby, and she's quieting and getting better. And Mom looks at me and she says, "So could this be emotional stress?" And I'm like,
they're all
smart
connected.
mom,
Yeah.
smart mom. They had been watching. They had had the television on for 9/11. For weeks they had had the television on for 9/11, and so right there in that segment of time between baby didn't need, baby needed, whether baby would have corrected from that type of tension, I think we heal, we naturally heal. We also hold things in our body if we're not able to find a safe place to heal. And working with adults or even adolescents that have traumas held in the body, you hold those postures for any length of time, and the body remembers it, and that is now the shape of the body, and that is now the boundary within which we function. And I think there's a reflection of that in our mental emotional wellness as well. So yeah, there's mental diagnosis is you can go down that road if you need to, but like you said, it is a holistic approach.
I understand it. You've worked with a wide variety of clientele over the last, well, you've been in Eugene since 1990, so over the last 15 years, and have invited some of the people that you've been working on to come on the show and talk about their experience. These are people who are clientele of yours and also professionals in the Eugene community. And I'd like to invite them on to talk about their experience. Welcome to the show, Joni. I'm glad you could come on and talk a little bit about your experience with Benjamin. If you would, share what led you to start working with him in the first place, your experience with the work, and what happened as a result of working with him.
Okay. Well, the first time I heard about Benjamin was hearing that he was actually offering to come out and welcome babies into the world. No charge. He would come and hold a baby and do a cranial session just to ease baby's transition from that life into this life. And I believe I called him first when I was working with a baby who was having difficulty feeding at the breast. This baby was opening its mouth but not very wide, really hungry, wanting to nurse and not seeming to be able to coordinate that nursing action. Benjamin came out and worked on the baby for maybe 20 minutes, and we saw immediate change. The baby went profoundly to sleep, and when the baby woke up, I was able to assist the mom in getting the baby latched on, and we had no further nursing difficulties from that time on. So I've been calling Benjamin ever since. Anytime we've got a baby that doesn't line up really well in the pelvis and has a long labor situation or a difficult push for the mom, a baby who doesn't look symmetrical when it's born, or any baby that's having difficulty at the breast, I basically insist that the mom and dad go ahead and call Benjamin and schedule a session as soon as possible. And those parents have been so happy with what's gone on that they've told everybody within the birthing community, the childbirth education groups that we have in our practice. I think probably 90% of the people that we work with right now call Benjamin because they've just heard really good things about the way he interacts with their babies.
Mm-hmm. It sounds like it's really complementary to midwifery.
It is.
Yeah.
Midwifery strives to be a gentle beginning for families, and that's just a part of it is having somebody like Benjamin come out and fully relax the baby into being present with the family. It's a lovely thing. It seems that the people that I'm working with are the lowest risk moms and babies in our community, and if only the people that are experiencing a higher level of risk could utilize Benjamin and other people like him to help ease the very, very difficult transition in that a high-risk baby has. The world would be a better place almost immediately.
Yeah, and that's what we're striving for. That's actually why this show was created in the first place, was to bring people like yourself and Benjamin on and give people in the viewing audience an opportunity to find out that there are alternatives to strictly traditional forms of medical care that can provide the kinds of experiences that you're talking about.
Well, for parents and nurses, lactation consultants, doctors that might be watching this show, I would like to go ahead and give the list of things that I've seen that Benjamin has facilitated change in. Tonic bite reflex, a baby really gripping and biting down with its jaws instead of having coordinated suck. Discoordinated sucks of all kinds. Babies who have discomfort from a birth-related injury and are unable to nurse on one side or another all get really good relief. And after I'm out of the picture, many parents have told me that Benjamin's able to relieve colic symptoms beautifully. I believe in this work greatly.
It sounds that way. And my understanding is that we have two other people who are also willing to come on the show tonight and share their experiences and their work with you. One of them is Rhonda Way, who is a speech teacher and mother of 2 boys with an autistic diagnosis.
Thank you.
Hi.
Welcome.
Thank you. Thank you. I have 2 very special boys, and I met Benjamin when my youngest son was 4 years old, and he had stopped talking pretty much, and he would vomit if people tried to talk to him from stranger anxiety. We started seeing Benjamin, and he, with another doctor, did four-handed work on my son. And then once he got comfortable, then my son would start going to Benjamin's one-on-one. And over time, we have seen incredible changes.
What kinds of changes?
You can't stop my son from talking now. And that's a miracle. And my youngest is almost 10. My oldest is almost 12. And my youngest has completely lost his autistic title. And
you attribute all of that or a lot of that to the work he's done with craniosacral?
It's a holistic view. You have to do intervention with nutrition. You have to do neural developmental exercises. It's a whole child package.
Well, it sounds like his work as part of that holistic regimen has been a very integral part of your child's healing process.
Yes, and we use Benjamin as a checkup too. When we change our supplements, we'll go visit Benjamin and see how everything's going with it. And if we had a bad virus, we'll go see Benjamin to help us bounce back. And so we use Benjamin in a lot of ways.
For a lot of different things.
And I recommend for any parent out there that has a child on the autism spectrum to come see Benjamin.
Thank you for coming on the show and sharing your experience.
Thank you.
Yeah.